The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. I'll get an episode with just Ciarra and Samantha today because we're going to talk about the most frequently asked question in an interview, well, just like topic in an interview with somebody who wants to see if they want us to be their doula. What is that, Sam? What do they want us to do?
How are you going to advocate for me in labor? And this is such an important topic because as a doula, and I think we might get a little spicy here today. Some people might have some feelings, and that's fine.
I always feel like the midwife's cauldron when we do that because one of them is always like, we're just going to make everybody mad. It's fine.
It's just where we're at. So as a doula, this is like a hot topic of conversation with doulas is how do we advocate for people? Do we advocate for people? Is that our role to advocate for people? And some people feel so strongly that absolutely not. We do not advocate. Our job is to just be there as a support person. We want to support our clients. And then other people feel the exact opposite so strongly that our job is to protect people from the bad things that can happen in birth. And as I think what is fairly common with Ciarra and I, we take a little bit of a middle ground approach. We believe firmly that advocacy is in the scope of a doula. Like that's just it. I think even a friend who is attending a birth, that would be in that scope as well. Anyone who is in a situation like that should be prepared to advocate. But I think that there are different types of advocacy that are really important for people to kind of understand. And so this is something that we talk about in our Birth Doula Training Academy. This is something we talk about with our clients. And it's something that we have found, kind of a way to do this that has worked really well for us over the years. And we're gonna share a little bit of that knowledge with y'all here today.
Yeah. And I also think, for a lot of you know that we're also birth doula trainers. So we have the Birth Baby Academy where we train people to become birth doulas and how to do that. And we have a whole section called client advocacy. And this is one of the biggest questions that we get from other people wanting to become doulas is like, how do I advocate? Because a lot of people are getting into this work because they're really excited to help people have really good experiences. And they know that sometimes the wall up against people is the provider, and that can really cause an issue, or that could be a nurse, it could be a midwife, it could be a doctor. So I'm going to explain the 3 different types of advocacy. I made up these names for them. It's not like you're not going to be able to go Google exactly what I'm talking about. But when we're talking about advocacy on a base level, it is helping someone be able to now I'm like stuttering because it is kind of a hard thing. So helping someone be able to get what they want in a situation and like standing to protect their space, whether that's a decision that they don't, of something they don't want, or a procedure they don't want done, or they just don't even want anyone to talk in their room, whatever. It can be so simple. It doesn't have to be something grand. So that is what it is. It's helping protect someone's space. But there are a few different kinds. And so we're going to touch on 3 different kinds. And so when someone wants to interview with us, we kind of talk to them about the why behind what we choose, but we'll talk first about what they are. So we have direct advocacy. This is what a lot of people think when they come to us and say they want an advocate in their labor. And that is when the doula talks directly to the provider about what the person wants. So if they are wanting to, it's 20 minutes on, 40 minutes off, maybe for the monitoring, for the continual or the intermittent fetal monitoring in the hospital, and 20 minutes is up. And the doula could say to the nurse, hey, the 20 minutes is up. They want the monitors off now. Whereas, that's me talking as the doula directly to the provider. Now, that makes it sound like I'm questioning them or making it seem like they're not doing their job very well, right? They don't love that because maybe there's something else going on. Maybe, they have to have 20 minutes on to get a good read of the baby's heart rate, but maybe the baby was moving around so much or the monitor got moved when the mom moved and changed positions. And we actually only got 15 of that 20 minutes. So maybe there's another 5 minutes that they need to do. And I would have known that if I would have instead used a conversational advocacy method. So do you want to talk to us about what that would mean, or what that would even look like in that situation, Sam?
Yeah, yeah. So, if the direct advocacy is talking for them, conversational is kind of just having like a conversation with the provider by asking questions, but not questioning them, right? So, this might look I'm trying to think, like a cervical exam. So, a provider says, hey, it's time for your cervical exam. And, we know that our client doesn't really want to have cervical exams on a schedule. They want to have cervical exams when it's necessary. So it might be like, is there something going on that you are looking for? Like, what would you expect the cervix to be? And just kind of like opening up a conversation at this point, like, is doing this cervical exam, like, what are we going to do after the cervical exam? What might happen with the cervical exam? And then that kind of just opens up the conversation of a like, hey, I just want to learn from you, doctor person, about this thing rather than I want to know, I don't want you to do this thing, which by having that conversation, and opening that door to kind of talk about it, that allows your client then to come in and ask questions, or our client to come in and ask questions. And it allows the doctor to kind of just expand, or provider, whoever, expand on what it is that they're wanting. Because sometimes it is just like, well, it's, 4 o'clock. We do cervical exams every 4 hours. It's time for a cervical exam. And they are kind of just like in their groove because they have 12 patients laboring right now that they need to get to. So, hey, let's kind of figure out why, for me as an individual, why do I want a cervical exam right now?
Yeah. And if you were going back to the direct advocacy model, it would have been no, she doesn't want cervical exams on a routine schedule. But
Right.
what if the answer, if you opened it up as a question of, oh, what made you, just out of curiosity, what made you think that we need a cervical exam now? Or what are you looking for? And then they could say, oh, well, the baby's heart rate has been dipping at the peak of the contractions, and it's making us think maybe she's further along or whatever. And by the way, even that isn't necessarily a reason to do a cervical exam, depending on how low that heart rate is going, but that's another issue. Um, that opens up the conversation instead of just assuming or questioning them. Why do you need one of those? It's, oh, how you ask the question. Oh, what made you curious about what the cervix is doing right now? And if we bring it back to my first example of monitoring, instead of saying, hey, it's been 20 minutes, she wants the monitors off, if you could say, hey, it's been 20 minutes, did you guys get a good enough read yet to be able to take off the monitors? That opens up for the provider to give more information on that. And the first one, direct advocacy, that seems confrontational to most providers, even if you don't intend it to be that way as the doula. So if you're our client and we just keep being a direct advocate over and over and over again, then what we're going to see is a provider that gets turned off to doulas. And that's not good for anybody. It's not good for my next client that I go in with, that they're remembering, oh, great, it's this doula again. And it's also not good for the mom who I'm serving in that moment, or the family that I'm serving in that moment, because it often puts a mom into fight or flight, or the birthing person into fight or flight, because they're sitting there going, ugh, there's like so much controversy in the room. There's like adversarial stuff going on. I'm stressed out. What does that do? Fight or flight makes contractions space out. Like, it's just not good for anybody. And a doula can be kicked out of the room, y'all. So that's also not good for anybody. We're defeating the purpose there. And then they just don't like doulas in general, could be part of the issue as well.
And if we can get the same result with a less confrontational approach, then that's ideal for everyone. And really that's what it is, you know. The next kind of advocacy that we have is the empowerment model, is what we call it. And this is really just empowering our clients to ask the questions, to be the one saying, no, I don't want this, or yes, I do want that, or what if we did this instead of that? And asking questions like going through the brains thing, which is what are the benefits of this? What are the risks of this? What are the alternatives? What else can I do here? What does my intuition say about doing this as the birthing person? What happens if I don't do anything at all, if there's nothing? And can I have space to think about it? And if people were to work through all of those, or at least most of those, then I think we would be seeing a lot less unnecessary intervention, a lot less birth trauma, and just negative feelings toward birth experiences. Because even if all the things do happen, you go through the brains, and then you decide, yeah, I do want that intervention, even though that's not what I had initially planned, and that kind of sucks. That is still going to help you as a pregnant person, as a laboring person, feel empowered and feel as though you had some control over the decision-making process. And in the long run, that is a large part of what is going to prevent birth trauma, which is what advocacy is all about. It's preventing negative outcomes.
Yeah, with the thing that's kind of hard is as a doula, it feels like sometimes, why do we even have to ask questions? Why do we have to do this? Because they should just be giving this information freely. We shouldn't have to say, why do you want a cervical exam? Because they should have come in saying, hey, I'd like to do a cervical exam because of XYZ. How do you feel about that, to the birthing person? Rather than saying, hey, it's time for a cervical exam, right? But that's an ideal world. We would love that. And that's just not what we always see. Even with providers we like, sometimes
Right.
we have other things happen. And so we prefer to go with the empowerment model because we start preparing parents in pregnancy for this. We start preparing partners for how to ask those brains questions. And we teach that in our childbirth education classes. It is so important to know before you go in, but it's also really reasonable for a birthing person and their partner to be kind of out of it in a sense of, I'm not really using my logical brain right now. I'm more emotional
Mm-hmm.
brained right now. And you forget sometimes to ask those questions. And that's when a doula can switch over into that conversational advocacy, where we might have loved it if you could just be empowered to ask those questions on your own. But sometimes we can step in and have this little in between of conversational. And sometimes that looks like, a provider saying something and me pinching dad on the back of the arm to help remind him
Mm-hmm.
that, like, hey, you're on. This is what we talked about prenatally. That I would pinch the back of your arm when this situation came up, so that you could ask questions. Just start with those brains.
Mm-hmm.
So
Or
that
writing a
is,
sneaky little text on your phone and
yeah.
showing it to them. I've been known to do that a time or two.
Man, when masking was in the hospitals for me, I was
Oh,
so
yeah.
hard for me. I was like, no way could I ever get Botox. I've really got to use these facial muscles to, like, no, be able to shake my head and furrow my brow, or like raise my eyebrows. Like, yes, I like that idea. Now I can at least be able to mouth things a little bit more
Mm-hmm.
easily, as long as a provider can't see my face. But, that is why we choose to do more of an empowerment model with a sprinkling in of conversational advocacy, because we really like our clients to be part of the process. So if you're about to interview with us, or you've already interviewed with us, or we're your doula and you kind of forgot that and you're now listening to this episode, that's how we're going to do things. We're going to empower you. We're going to pinch your partner on the back of the arm if there's something that you are, maybe, we want to make them come to and remember to say. And if you guys don't have that capacity in that moment, we're going to switch to more of a conversational advocacy, where we're going to start asking questions in the room with the provider there. Or maybe that even looks like, oh, hey, they're saying that I heard the doctor say that they're about to clamp the cord. Is that okay with you? I'm not even talking to the doctor or the midwife or whoever. I'm talking to my client of, hey, is
Mm-hmm.
this okay with you? They're about to do this. Or I just heard them say they want to start running the Pitocin. You hadn't wanted prophylactic Pitocin. Are you okay with that? I'm not even talking to the doctor. Now, do they necessarily love that I'm asking that question when they hear it? No, not necessarily, but it's not my job to like, make everyone love me all the time. But
Yeah.
Sam, do you want to talk about when we might forego all of this and go to direct advocacy, some situations
Yeah.
that might call for that?
Yeah, I mean, I think all of these types of advocacy definitely have their place, right? Like we have our preferred approach, which is empowerment or sometimes conversational, but direct advocacy absolutely has its place. And that is in times that the health of the mom or the baby might be in jeopardy here. And that could include mental health as well, if there's something going on that we absolutely can see is going to cause trauma. So a example of this might be when we see a provider picking up scissors to cut an episiotomy. I might say she did not want an episiotomy. Can you ask her about that? It might be something like that because in that moment when they're picking up scissors to cut the perineum, I probably don't have time to initiate a conversation with the provider about that or to talk to my client about that. And especially in a situation like that, if they're picking up a scissors cut an episiotomy, it's either an emergency or it's their preference. And in that case, they may not really want my input. But my client has the right to decline anything at any time. And if they don't want an episiotomy, they should be able to say that. That's still within your right as a patient in a hospital
Even
or
if it's an
anywhere,
emergency, even if it's an
even if it's an
emergency, even if
emergency.
it's the baby's heart rate is totally tanked and they're like, we've got to get this baby out on this next push and they're about to cut, they still should not do that without like talking to you about it. And they could have seen 2 waves ago, probably that, hey, we're contractions ago, like we
Mhm.
might be moving that direction.
There's
I've had
always
providers
time.
do that. Yeah. I've had providers say, like, hey, I do not want to have to give you an episiotomy, but if we don't get this baby out on this next contraction, I need you to give it all you've got because I'm going to have to cut in order, or we're going to have to go to the OR. Which one do you want to do? Um,
Yeah.
so
There
that
also
is important.
yeah, absolutely. And there also might be times where you as the client and the partner are just so tired that you don't want to be doing that anymore. And you are saying, maybe even in front of your nurse, hey, I want you to have this conversation with them and let them know what you are what we're thinking according to our birth plan or, something like that. Or it might be that it's an emergency situation and you aren't with it enough to be able to answer questions. So then I can say, no, she did want that. She didn't want that. When we go into the OR, can we make this happen for her because she really wants that? And sometimes that's even just what it is in the OR, I might be saying, hey, she really wants skin to skin. Can we please get baby for skin to skin? Instead of a conversation and just kind of calling attention to those things.
Yeah.
So there's absolutely a time and a place for all of these different models. I think that as doulas, we have to walk a very thin line of advocating for our clients, helping our clients have the birth experience that they deserve, that they have planned for to the best of their abilities, to the best of our abilities, and also to know that we're going to be walking back into this space with these same providers again someday. And I don't want there to be a bias against me simply because of who I am or what I do or what I have done in the past. So I want to make sure that we're really walking that line. Ultimately, I work for my client. I do not work for the hospital. I do not work for certain providers. I am, kind of a solo entity in the world with Ciarra, where we together are a solo entity in the world. But we are also kind of part of this bigger picture of birth workers in Austin, in Texas, in the United States, in the world. And negative experiences with doulas is going to negatively impact all of us, which will negatively impact people who are having babies.
Yep. Yeah, real quick, one other, maybe example of when direct advocacy might be necessary would be a single parent who's coming in and laboring on their own, or their partner has left and they're like, left for a couple of hours to go take a nap or something like that. And we may need to step in a little bit more. But in those situations, I'm going to communicate with the nursing staff that's in that room or the doctor or whoever is in the room and say, hey, she asked me to speak up for her a little bit more because her partner is not present or she doesn't have a partner. And so I just wanted you to know that I'm not trying to be adversarial. I'm just filling the space that she asked me to fill, please know going into this that I will have a little bit more of a direct role than I normally would. And just so that you can preemptive strike their opinion on how you're behaving. But, those again are exceptions to the rule. And this is just how we choose to do it. And there are doulas out there that choose to do it other ways, and we respect that.
Yep.
But if we're your doula, hey, this is how we do.
Absolutely. Awesome. Well, thanks, guys, for listening, and we'll see you soon.
Bye.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.